a lot of people would argue that we have this improvement in survival for women with ovarian cancer, and they're living longer because we've been able to cobble together small advantages in survival for drugs that are often used over a long period of time. And again, I think that's something that's very real to patients. That's a phenomenon in the real world. When you're looking at a trial design, trying to incorporate that phenomenon into statistics is something that's very, very difficult. And I think we need to recognize that, and I think that's why we need to weigh the pros and cons of a very clean, statistically sound trial design with something that we could apply in a real world setting, because survival certainly is getting longer for ovarian cancer. Despite its limitations, I think the most reasonable endpoint we have is probably progression-free survival at this point. I think it's not possible in most of these scenarios to measure overall survival. So I think if we measure overall survival, it's a setup for failure. And what you're seeing is that these drugs do have activity in ovarian cancer. We know these drugs have activity, but just how we quantify that activity is, I think, what we struggle with. And probably right now the best thing we have is progression-free survival.